My name is Ryan Donegan. I'm an orthopedic surgeon and shoulder and elbow specialist here at Bluegrass Orthopaedics. Shoulder arthroplasty is a term that we use to describe a shoulder replacement. So it's a replacement of the shoulder joint. Typically what we do, as you can see in some of these models here, is we actually try to replace the cartilage that's been damaged here. So in this model, this is the ball of the ball and socket joint. You can see by loss of this blue cartilage surface that the cartilage surface has been damaged. Typically in a shoulder replacement, something like a total shoulder replacement, we actually replace the ball. We do the same thing on the shoulder socket, where you can see on this shoulder socket, in just a small area here, the cartilage has been worn. As a result, we go ahead and we actually replace the socket by actually resurfacing it to create a nice smooth surface for the shoulder. Typically, when we do a shoulder replacement, we do that in individuals who are typically ages greater than 50, 55 is typical. Most commonly, on average, it's probably in the neighborhood of 65 to 70 is the typical patient that I see. But patients can remain active. So I think that we have this understanding of shoulder replacements being something that patients aren't allowed to do much after having a shoulder replacement. But with a standard, regular total shoulder replacement that we do, I allow them to pretty much return to normal activities, including things like recreational weightlifting and their normal sporting activity. So I think of the recovery process in three particular phases. The first phase, we're trying to protect some of the muscles around the shoulder. What we typically do is put patients in a sling. Sling use is somewhere in the neighborhood of 3 to 6 weeks after surgery. I'm still allowing patients to do some simple exercises that typically are around waist level or chest level. After that 3 to 6 week period, we're starting to get your range of motion back. So I get patients out of the sling. I allow them to move their shoulder without restrictions. And then after that 10 to 12 week period after surgery, we start strengthening. Typically, for most shoulder replacements, it's a 3 to 6 month recovery period after a shoulder replacement. If you're having shoulder pain and would like to see me for your shoulder condition, please visit our website at bluegrassortho.com or give us a call.